Welcome to Coffee with Marci, where everyone has a voice. And today I have Dr. Peter Denoble on. He's an orthopedic surgeon, and he is with Advanced Orthopedics and Hand Surgery Institute. Hello.
Hi.
Welcome to Coffee with Marci.
Thank you for having me.
So awesome to have you on and share with everyone what it is that you do and what your practice can do for all of us. So I just wanted to, first off, how's your summer going?
Summer's going well.
Yeah.
Trying to enjoy the when it's warm in Jersey, you try to stay in Jersey.
Exactly,
Enjoy it.
exactly. So it's great that we have the good weather now and we get to go to the shore. And you went to Cape May, is that right?
Cape Cod. Actually, yeah, we took the drive up.
Oh, beautiful.
I grew up that way, so originally, so it's first time actually has been back in like 25 years.
Oh wow!
So got to show the kids around a little bit. Yeah. It was
And
nice.
where did you get to show them where you lived?
Oh well, yeah. So every summer my parents would go down to Provincetown, which is at the very tip of the Cape, and this time we spent some time in Falmouth, and then Cape at the end, which is Provincetown, which is beautiful beaches. Yeah, it was nice.
Oh, well, wonderful. Well, Dr. Denoble, why don't you tell us exactly what it is that you do and a little bit about your background?
Sure. Well, like I said, I grew up actually up in the Boston area, but my training took me down to this area in Manhattan, or I did my residency in the Bronx and then did my fellowship training in Manhattan at the Hand Center, CV Star Hand Center. And then I've been in practice here for going into my 7th year now.
Wow.
Our main practice office locations in Wayne, and we have 2 satellite offices in Parsippany and in Clifton.
Okay.
But we go to a lot of the hospitals around here, St. Joe's, Wayne in Patterson, Valley, Chilton, and St. Clair's.
Okay.
So it's a quite.
But you're primarily in Wayne.
My main office and most of my time I do spend in the Wayne office.
Okay. So why don't you tell us about your practice?
Okay. Yeah. So what I do is orthopedic surgery.
Yes.
My specialty, my subspecialty training in orthopedics is shoulder to hand. So that's really anything related to that. If you have shoulder pain, that's the reason that people come to see me. If you have hand or wrist problems, same thing. You get the whole gamut of injuries, chronic pain. We talk about carpal tunnel, which is very common.
That's a big one.
Yeah.
Yeah.
So a lot of elbow things, elbow conditions, tennis elbow. And you see a lot of overuse injuries between work and sports. So there's a million ways that you could end up getting into my office, unfortunately. But the nice thing is that we have a lot of good ways to treat these problems.
Right.
And it doesn't involve an operation.
Oh, that's great to hear. I mean, who wants to be in surgery, right? And then the
especially
recovery. But why don't you tell us, first of all, what is orthopedics?
Yeah, so I think it's a confusing name. It doesn't sort of have intuitive feel to it. So people often ask me, do you do surgery? And yes, I'm a surgeon, but it really encompasses basically the musculoskeletal system. So that includes all your limbs, your spine, anything that has to do with the muscle, bone, tendon. That's an orthopedic surgeon sort of realm. Within orthopedics, such a big specialty that there's subspecialties. So my subspecialty is the upper extremity, shoulder, elbow, hand, and wrist. Whereas other people specialize in joint replacements of the hips and knees, or knee arthroscopy, ankle, foot and ankle. So there's literally a book or 2-volume chapter book on each joint. Yeah. So I mean that's how much information and how many problems there are with each and every little joint and whatever in our body. So it's
there's so many possibilities that you just walking, you can end up injuring yourself some way or picking something up. Yeah. Right?
It happens. Yeah.
And so what are the common, you touched on it, but I'd really like to talk to the guest, the viewer. What are the common things that you see when people come in? What are you treating?
Yeah, so, as an upper extremity surgeon, I'm seeing people who come into me, I'd say very commonly, I think we talked about carpal tunnel. Yes. Carpal tunnel is a very common thing. A lot of people get it for a lot of different reasons. Most of the time it's just using your hands and it's overuse of things. Maybe not even overuse, sometimes it just happens. A lot of women get it in and around the time of pregnancy, even, or in the postpartum period. That usually will go away on its own. You know, and we have basically a lot of different ways we can treat that. Most of the time, it's with bracing at nighttime. Some of the symptoms that I hear people come in, and very, very commonly, it's that pain at nighttime, that aching pain that may wake them up, where you wake up and you're shaking your hand,
right,
you're dangling your hand off the edge of the bed, or people, they'll be driving, and you know, when I drive a car, I have to let go of the steering wheel because it starts to go numb, it starts to hurt. So those are the sort of symptoms that actually are for carpal tunnel, and that's one of the most sort of, it's a very common thing people talk about, carpal tunnel, but those are the actual symptoms, and it's those symptoms. You may even get numbness through these 3 fingers, the thumb, index, middle, and even part of the ring finger as well. That's that median nerve distribution that is squeezed basically at the carpal tunnel, which is right at the bottom of your wrist here. And so if all the conservative management issues like or treatment options, which is like bracing and occasionally a cortisone injection is very helpful. But if it's been going on for a long time, maybe even over a year or more, sometimes a little operation, or even I don't even call it an operation because that sounds too big. It's really a procedure. I even do it under straight local, where you don't even have to go under anesthesia.
I was wondering about that, like how, you know, what exactly the surgery would be, because I know when I used to work with the computer a lot, and you know, you have your hands up like this, and none of us are sitting really at the right angles, right? So I had a lot of pain through here, and thankfully it eventually went away.
Yeah.
But I know that there are many people that have to have surgery. So how invasive that is, and what the recovery is on that.
It's very good news on all fronts. It's a very simple operation. For I'd say most people who are able to tolerate just kind of being in an operating room and kind of watching people walk around and tolerate just kind of listening to us, our you know, music. I usually actually have my patients select the music, so that way they can be at peace. But it takes about 15 minutes, and we set things up and basically just numb up the area locally on your palm and your hand area. And it's a very small, like centimeter long incision, kind of like right in the palm. And there's different techniques, but my technique I use, it's a little small thing. It usually falls into the crease of your palm, and I use a little scope, so it's endoscopic, it's minimally invasive.
Wonderful.
And so it goes in, you don't feel it if you're doing it under local and you're wide awake, you wouldn't feel it at all. And next thing you know, there's a little blade that just basically goes in and just cuts the little ligament that kind of creates too much pressure on that nerve. It just releases, and then a couple stitches and you're done.
Amazing.
Yeah.
And I think a lot of people probably live with that pain.
Yep.
And they don't need to.
Yeah, and most of it's because they've heard of horror stories, or they think there's some big production or some big recovery process. I wrap people up in like a little bit of, I say call it a Band-Aid plus. It's a little wrap around your hand, but I have most of my patients going back to what they want to do that day or the next day.
Because that's another thing I think, kind of touching on that, is I think we live with pain that we don't need to live with.
Yep.
And also, if I understand correctly, the longer you go, it could create a larger problem for yourself.
For some issues, that's definitely the case. Carpal tunnel is one of them, actually, because not only does it hurt, but over time, when that nerve's been squeezed long enough, you can actually get more permanent or more severe numbness, where you actually have trouble putting your buttoning up a shirt or handling coins, little fine motor dexterity things. That all of a sudden you feel like, well, you know, I've been blowing off this pain, but now I'm actually numb. And that releasing the carpal tunnel for that purpose takes a lot longer to recover from. I tell my patient that's going to take a year. Whereas if it's just pain and it's early on, that goes away almost immediately.
Isn't that interesting?
So I kind of want to make sure.
Listen to this, guys. You want to get in there if you're feeling this. Yeah.
It's good to just have someone evaluate it, because sometimes you think it's carpal tunnel, it's something completely different, or even if maybe it's a tendonitis, it just needs a little cortisone injection and it'll go away the next day. So
so let's talk about. We start with the shoulder. So what are common issues with your shoulders?
So I'd say probably the most common thing that I see is rotator cuff pathology. Basically, whether it's tendonitis, and that's a spectrum all the way from sort of a tendonitis or something where the tendon kind of hurts or isn't quite as normal as it should be, all the way to where it's torn, partially torn, or really torn, where it's really starting to pull back. The muscles are pulling the tendon back.
Right.
And that's sort of the spectrum. And that's another one of those things where if you just let it go too long and it's really torn further, you could end up having an issue where it's harder to repair later on. So I have a lot of patients who have tears who I offer surgery to or therapy, and they say they don't want to do surgery, and I say that's good. Let's keep an eye on it, because sometimes over time that tendon can start to retract.
Okay. And
when it retracts, I tell people it's kind of like a garage spring.
Yeah.
Whenever it pops off, and then all of a sudden it's completely away from the. So you don't want that thing to be all the way back, because otherwise you're not going to be able to pull it out.
Right.
Say years later.
Yeah.
And then you're kind of not able to restore that normal function as well.
Right. Right. And then also elbows. So what's normal? The common things you see with the elbows.
Elbows. Buddy.
Oh, Lucky's joining us, saying
Lucky.
hello.
Hi, Lucky.
He likes Dr. Denoble here.
Lucky's great. Elbows, I think a lot of times it's a lot of overuse injuries. You see a lot of tennis elbow issues, which is something that typically, and I'll tell you, this is a tip, tennis elbow is very common, and it's really annoying because it hurts. Whatever you do, it's not just when you're playing tennis.
Right.
In fact, most of the time it's not from people playing tennis.
That's exactly right.
But it hurts when anytime you use your hand to grip something or twist something or grab something, and it's something that usually goes away on its own. About 80% of these will go away, but it takes sometimes 6 months or up to a year to go away. So a lot of my time in the office is actually spent educating my patients about what it is. Be patient; it'll probably go away. I actually had it for a little while when I go golfing like once or twice a year.
Yeah, yeah.
And so that's what happens when you do something like that.
It happened to me, and it was from lifting weights.
Right. And if you're introducing any kind of new stress to your upper extremities, that's a very common thing for your elbow to say, hey, what's that? And then and sometimes once that starts, it takes a little while, but it eventually goes away.
I think mine was just age.
I hear that a lot, by the way. I hear this is just old age, but that's never the case. That's usually never the case.
Oh, okay.
But there are a subset. There is probably about 20% of the 15 to 20, I'd say, that no matter what you do, as patient as you are, it doesn't go away. And then that's at the point where I can say, all right, let's start to explore other options other than sort of rest, therapy, and bracing.
What would you do?
Well, there's a variety of things. One of which is there's some newer sort of biologic solutions to this, and it's not I would say it's probably I'll just say it's called PRP, platelet-rich plasma. It's something that the insurances don't cover.
Okay.
So that's something that people immediately are like, well, I'm not going to pay for. Yeah. It's usually about $600 or $700, depending on which doctor you see. But that is something that has been shown in just a few studies to actually change that natural course. It'll actually make, over the course of 6 months or so, you may get better with PRP. The other thing that I actually very commonly do is an elbow arthroscopy. So where I put a scope inside the joint.
Okay.
And it's just through some tiny little holes, poke holes, and it basically allows me to look inside the joint. Sometimes tennis elbow is actually accompanied by other problems inside the joint that you don't even get a chance to see unless you're looking inside.
Oh, interesting.
And then you can do this thing that releases the tendon. That's the sort of the offending problem with tennis elbow. And then the patients obviously at that point are feeling better. Usually it takes them about 6 to 8 weeks to feel like this is definitely working and I'm better.
The thing that we really need to listen to our children if they're saying that they're having pains, to address those.
Absolutely. 100%. I spend most of my time with parents and their athletes that come in to see me, basically just trying to explain how the body works, in the sense that you just can't keep tugging on a rope. Eventually it's going to break. You got to give. And the nice thing with the body is that rope will heal. It just needs it needs time.
Yes.
And so a lot of my time ends up helping people understand just the restorative nature that you need to basically give your body rest. You have to give it that time. And you also have to do very specific rehab for your body because, and there's a lot of good therapists out there that can really...
you have therapists that you work with?
Yeah. And having been in practice for, enough years now, I know, some of the best therapists in the area who can really get
All right,
things,
that's great.
Yeah.
Because it's like once we leave you, obviously you're going to be helping us on how to recover and who we need to see.
Right.
And
oftentimes that's the most important thing, and I do kind of see people back sometimes a month or 2 months later, and I don't see a lot of progress, and that's, it's because of the therapist. So it's important it's not only just what the therapist is doing mechanically, a lot of it's also the relationship. Some people have to have the right relationship. Some of my best therapists, sometimes my patients say, well, I didn't get along or this or that. It's just everyone has different personalities, and so sometimes that therapist may not be right for you, and I just that's why it's nice to have a different complement of people who can sort of treat you and sort of get your personality. It's very important.
Well, it's true, because with anything, like the bedside manner and how they treat you with any doctor is so important. And so that kind of, leads me to my next question. So why does someone want to come to you? How are you different in your offices, and what's the experience?
Yeah, well, just from my perspective, I always want to make sure that by the time someone leaves my office, they feel like they have control of their problem. They don't feel like I just said something and they're not sure what I said. I tend to repeat myself a lot, which means the visits usually take a little longer, but I want to make sure that in the moment you're
understand.
You're recapping, you're summarizing, so that by the time you're leaving there, you feel like you understand the plan as well as I do. That's great. And that you can feel confident that there's an end point coming in the future. And that's really the basics of what I don't know if I'm different than others, but that's at least what I give to my patients, and I think they appreciate that.
Yeah, absolutely, because this is something that most of us don't understand, and I think there's a lot of fear involved going to a doctor, and when it has to do with your body, and
for sure,
nobody wants to have surgery, and it sounds to me like you do everything possible.
Absolutely.
So that is not something, that's not the first thing you go to.
Yep, that's absolutely right. And I think that's a lot of times the fear that patients have when they have a problem. They fear, especially going to someone who's a surgeon. Well, I don't want a surgery. But that's one of the many things that I do, and it's one of the last things I do. What I do is when I see patients, I just evaluate you, and let's see how we can get you back as quickly as possible. If there's something that can get you better to the exact same point quicker and without surgery, that's where we go. 100% every time.
And there was one other thing that you were talking to me about, and I'd love to share with the viewers, is how to take care of like a cast, because I know when our kids have their casts on, what exactly do you suggest?
It's a big point of concern over the summers. We're in the season now where there's a lot of emotional stress when the child comes in or has broken their wrist or their elbow or what have you, and usually it requires immobilization. It usually doesn't require an operation, but that immobilization requires a cast, and the cast is not the most pool-friendly thing that your kid can have.
I know. So, how sad, right?
Particularly,
can't be in the water.
Yeah, exactly. So one of the things, a couple of different solutions. One is in our office we actually do provide an option for Gore-Tex casts. Those are basically water resistant, but they also are breathable, so it's this special material. It is a little more expensive, so it's a little added cost if you elect that you want your kid to have that. Usually the cast is on for about 4 weeks. So it's a month. You only get a couple good months in the summer. But the other thing you could try is these things called, one of the companies is called Dry Pro. If you look up drypro.com, I think they have a website, but if not, just Google Dry Pro.
Now, can you swim in these?
Dry Pro is designed for that, and a lot of times these companies will advertise them, no problem, 100%. But I will tell you, nothing's 100%. So even if you use this, you still have to be cautious. You can't, just let your kids fly and come back at the end of the day and see how it's going. It's really, and usually most of the kids are pretty good about it also. But you just don't, the one thing you don't want is a wet cast, particularly a dirty wet cast. That can be extremely frustrating and itchy, painful, you know. And one thing I will warn people, and make sure that you don't do if you have kids or something, or even your own cast, try not to shove things down the cast. Everyone gets that coat hanger and gets going.
Yeah.
But you know, there can be major problems with the skin. You can excoriate the skin, basically scratch it enough that it could even get infected. Right? So it's like one of those things you really want to itch, but you know, I always tell people that's why it's most important to make sure your cast gets dry. Yeah. So if your cast gets wet, and if I give you a Gore-Tex cast, you can get it wet, but you also got to get it dry. And that's, you know, there's a little instruction booklet that I give people that comes with it. So that's helpful. Yeah.
One last thing I wanted to touch on was the Doctor-Patient Alliance, which is something you were telling me about. So tell the viewer a little bit about that.
Yeah, it's very exciting. We're actually a very new group in New Jersey. And it basically is doctors who are, myself, I'm the founder of the group along with 5 of my other executive board members, and we have a large growing group. We have over 100 doctors now. In the past 3 months, we've been very effective in basically mounting a doctor public relations campaign, because for so long doctors have been sort of doing what we do in our offices. We've been busy. We haven't spent time enough to remind the public about what we've done. And so much of what's gone on in the public related to doctors is, you know, doctor went to jail for this, or doctor sent you a bill that they call surprise bills. And so we're losing our image because of these other problems that aren't even our fault a lot of times.
Right.
And so we have to sort of, we're kind of recentering the issues and starting to remind the public about not only what we do, but also how they get affected by laws that get passed, particularly in New Jersey, related to their ability to access doctors that they choose. Doctors that they say, you know, that's a doctor that my friends or my family have gone to for a long time. They're quality doctors. They give great care, and you don't want the insurance company or other companies telling you where to go, who to see. I mean, surgery is a big deal, and unfortunately, it's not it's not a cookie cutter thing. Right. There's a lot of variation, and you should be able to choose who the doctor is.
It's nice to hear you say that. I mean, I agree, and a lot of people, they only have so many that are in their plan, and they don't want to go to them. They don't know anything about them.
You've either got a very narrow network where basically you're limited to like 1 or 2 specialists. And you know, you find out about that those aren't the specialists that you were recommended, and you've done your research, but then you're stuck. And that's a product of the insurance environment and some of the things that we're trying to prevent that from getting worse.
Wow. Okay.
And so it's really a patient empowering group. Right. It's called the Doctor-Patient Alliance, and I think in the next few months we're very excited about some new products that we're going to be able to sort of roll out. It's actually going to be a way. It's almost like a patient navigator. We're going to basically have an advocate that the patients can call and say, you know, I'm confused. I don't understand. The doctor's billing company is saying this. The insurance company is saying this. Help me. Yeah. And I think that with that sort of safety net, so to speak, available to people,
that's wonderful.
I think that'll solve a lot of the anxiety that goes on after.
People feel helpless almost.
Yep.
You know?
I totally understand it. Obviously, you know, my wife, she went through a big surgery in the last, earlier this year. Yeah. And, you know, the amount of the doctor bills that come through and, you know, just because we're both doctors, fortunately we understand the nuances of it. And look, a lot of times a lot more does come from your pocket these days, but knowing that you need to basically make phone calls. It's not something that says, please call and appeal this. Yeah. You have to just know that. And if you don't know that, you might be apt to say, I'm on the hook for this. I have to pay this.
Most of us don't, right?
It's crazy. And so, you know, this is important for people to understand. And we're going to do our best to hopefully educate the public about this, because it's important.
So this is something that you're going to roll out in the next month or two, a couple months?
Yeah. You know, a lot of it ends up becoming an issue of funding and you know, hey, we're open to donations as well. But what we want to do is also through our membership, it's going to be free for patients to join. And as doctor members, we're the ones putting up dues and paying into the system that will ultimately help patients. And that's something that I think is very unique and that hasn't been done anywhere really.
So I'd like to invite you, Dr. Denoble, to be back on the show maybe next month, and we can do a full show on this Doctor-Patient Alliance. It sounds amazing.
Yeah.
And I know certainly that the patients would benefit from this.
There's a website that we have also. It's called drpatientalliance.org, all one word. And so if people wanted to check that out, it's not the patient aspect of it isn't developed yet, so it's not there yet, but it will be. Okay. And so but you can see kind of where we're going with this, and that's really what we have in mind. Is that
that's fantastic.
It's something that no one's speaking for the patients, right?
No,
that's really. We realize that, and that's what's new about this group.
Well, thank you for that, and thank you, Dr. Denoble, for being on the show.
Thanks for having me.
And please, if you have any questions, please reach out to Dr. Denoble, to call his office. Please. So, Advanced Orthopedics and Hand Surgery Institute, and that's in Wayne. So.
We're on Facebook too.
And on Facebook. So we will have this information, but if you want to give your website really quickly, that'd be great.
The practice website's advancedorthopedicsnj.com. Orthopedics is with a P-E-D. Sometimes it's spelled differently.
Yeah, exactly. So thank you all for joining. It's great to be back after vacation, and I'll see you on Thursday. We're going to take a tour of a beautiful home in Franklin Lakes. So have an awesome day, and we'll see you soon.